Standard therapies in Europe are characterized by some of the prospective trials that in T-cell lymphomas have set the scene, since this is notably a rather rare disease where it is difficult to gather patients into clinical trials that are sizable enough in order to make safe conclusions. Our consortium in Scandinavia, in the Nordic countries, has been contributing to this part of the story by delivering the so far largest clinical trial, the prospective clinical trial in T-cell lymphomas. And from that work and the work of other groups, importantly in the United States and Europe, there is now a fair amount of consensus which is reflected in the guidelines, European guidelines. The ESMO guidelines were published here, the latest version in 2015. I was the lead author on that, and it is reflecting what we learned from those clinical trials I mentioned earlier. So basically, we have to take into account the type of patients that we deal with. That is commonly done both in Europe and the United States and in Asia, all those parts of the world where T-cell lymphomas are approached with modern therapies. It will be, if the patient is fit, a dose-dense chemotherapy with the consolidation of autologous transplant, which has been a controversial issue in recent years. Although now there seems to be converging opinions about the fact that there may be an advantage in consolidating an induction therapy with stem cell transplantation, autologous stem cell transplantation. So in that, both the American and the European guidelines are common, and Asian guidelines as well. Since there is this specific over-representation of cases of NKT nasal type lymphomas in Asia, the approach for that subtype is different. So in that respect, the treatment of T-cell lymphoma in Europe differs, because we don't have or only sporadically see those patients. So that kind of treatment is not often applied to our T-cell lymphoma patients, and by our I mean European ones.